Hello, everyone, and welcome to another episode of Autism Stories. I'm your host, Doug Bletcher, the founder of Autism Personal Coach. Autistic people are the true experts of the autistic experience, and Autism Stories is where we interview autistic people to learn from their diverse stories, experiences, and get their insights. If you would like to be notified about each week's episode of Autism Stories, we suggest you subscribe on your favorite podcast listening platform. On today's episode, Stephanie joins us to discuss supporting patients with their sexual and reproductive health needs as a registered nurse. We hope you enjoy today's conversation. Stephanie, thanks for joining me here on Autism Stories.
Thank you.
I'd love to start off by learning, where does your story in the autistic community begin?
Well, I have a story that's familiar to many assigned from birth autistics. I was diagnosed in my early 30s. I was misdiagnosed throughout my childhood and teens with a variety of mental illnesses, depression, bipolar, borderline personality disorder, heavily medicated for many of them. And I was in nursing school in my early 30s and was being labeled as confrontational because I have a need to know the why behind decisions, which, again, pretty common. So I would question my instructor on why we were doing things the way we were, especially if it was different than what we had learned in the classroom. This led to me having to meet with multiple directors and almost being expelled from my program. So I pursued diagnosis with first my primary care provider and then with a psychiatrist. I was able to avoid expulsion and learned that I just had to mask better in school.
Knowing the why, that has gotten me in trouble a lot in life. But as I've gotten older, what I've realized is that's just good communication. But
Yeah.
So I'm thankful to connect with you as I was looking for an autistic nurse or doctor that supports autistic people in their sexual and reproductive health care. What I learned was that it's not easy to find an openly autistic medical professional in this area. I know there are a lot more autistic nurses and doctors in the area of reproductive health. At least I believe that. That's my belief. However, I'm wondering, what might be some factors that might cause a nurse or doctor to not be open about their autism in the workplace?
One, I think it's underdiagnosed. Those with lower support needs might not have ever pursued a diagnosis or a formal diagnosis. So there's probably several doctors, nurse practitioners, and physician assistants who are autistic, but maybe don't know. Also, there's a lot of stigma. People tend to have a template or like a stereotype for what it means to be autistic. And typically, this template is one of two people: the socially inept genius, think Sheldon from the Big Bang Theory, or a high support needs, nonverbal child with violent outburst. And if you don't fit one of those preset stereotypes that someone has and you share your autism diagnosis, there's a risk of either being called a liar because you're not really autistic, or you risk the person will now expect you to fit their archetype. So having to fit that archetype can lead to unfair expectations, whether that expectation is now that you must know the answer to everything, or the expectation that you'll be violent. I actually ran into this the other day at work, where a coworker and I were discussing an upcoming patient with a history of violence towards staff. And we were trying to prepare to keep us both safe while ensuring the patient also got the care they needed. And my coworker commented that the patient must be neurodivergent or something. And I disclosed that I am ADHD. So I have autism and ADHD. And explained that a diagnosis of autism or ADHD does not explain the pattern of behavior the patient had, because they were only violent and aggressive until a provider was present. So it was like a complete behavioral shift as soon as someone with more authority came into the room. Autism or ADHD does not excuse that violence. And my coworker countered that she has a family member who has autism and ADHD, and that person's violent and has violent outbursts. So she thought everyone with that diagnosis would act like her family member.
So much education, still needs to be out there.
Even when I was in my graduate program to become a nurse practitioner, my advisor, who was also the program director at the time, commented that I seemed really tired by the end of the day. So I disclosed that I was recently diagnosed with autism and I spend my entire day masking, which is exhausting. And her advice was to drop out of NP school and go work in a call center, that I would not be successful as a nurse practitioner.
Well, she was wrong.
I've been practicing for 4 years.
Now, studies show that autistic people are less likely to access reproductive and sexual health care. Being that you're a nurse practitioner that supports patients with their reproductive health care needs, what do you think are some of the biggest barriers that autistic people face in not getting adequate sexual and reproductive health care?
I think there's a lot of different barriers here. Some kind of internal barriers are shame, avoidance of this type of healthcare due to past bad experiences. And also, I know with my autism, I'm very into rules, as we touched on a little bit. And I'll get more into the shame and avoidance in a minute. But one of the rules is that you don't discuss certain topics in public. And those topics include things like sex and body parts. So it can be hard to overcome that taboo and realize that a sexual or reproductive health appointment is exactly the appropriate place to discuss these topics. Also, there can be shame and self-judgment in having to come see us for a problem. Infections can lead to a feeling of being dirty or unclean, even though no infection or illness makes you dirty. On this topic, I hate the language of being STI negative or HIV negative means clean. No, it's negative. Clean is regard to your last shower or if you fell in a mud puddle. There can also be avoidance of seeing us due to negative experiences in the past, whether that's an assault or a bad experience with a provider. So things like a pelvic exam can certainly bring up flashbacks and emotions related to something like a sexual assault and other violations of your body. And as providers, we're well aware of this and can and do help patients work through that anxiety and panic in the moment. And also, if you think this may apply to you, I encourage you to prepare. Bring a trusted friend, companion, family member, partner who can stay with you throughout the exam, to hold your hand, talk to you, who makes you feel safe. And also talk to a therapist about your past traumas and get help processing them. And even if you have done that, these feelings can still pop up unexpectedly, and that's okay.
Thinking about barriers, many autistic people have interoceptive differences, meaning they might struggle to identify pain or where exactly pain is located in our bodies. How might this challenge be navigated in reproductive health appointments by the patient, medical provider, or both?
One way I love to mitigate this is with posters. This enables me and the patient to point to where pain may be and clarify. Also, anatomy posters help me demonstrate how crowded the neighborhood is. So, for instance, in those assigned female at birth, the bladder, the uterus, and the bowel are all just stacked on top of each other in your pelvis. So, even if you can locate exactly where the pain is, we don't know what's causing it. Another example of this is pain on your right side could be appendicitis, an ovarian cyst, ectopic pregnancy, which is a pregnancy outside of the uterus, or simply gas pains, which run the whole gamut from completely benign to potentially life-threatening. And being able to show people how many different organs are together seems to help. Also, another way to mitigate this is by asking a lot of questions. When did the pain start? What makes it better or worse? Is it constant? Does it come and go? Have you had intercourse recently? When was your last bowel movement? Going back to those taboo topics, we love to talk about them. And all of these questions give me information that I can use to learn what's causing the pain and how to fix it. And what patients can do is pay attention to their body and take notes about these things. So know when your last period started. Notice if it hurts all the time or sometimes, and things like that. Notice what kind of pain is it. Is it kind of achy? Does it feel like stabbing? What would you have to do to me to make me feel that same pain?
Earlier, you were talking about rules and these appointments, and that really resonated with me. And I'm going to probably date myself with this reference, but in my mind, the song by Salt and Pepper, "Let's Talk About Sex," kind of came to my mind. Where do you feel like we are in terms of education for neurodivergent people in kind of understanding these things? Because then rules kind of come into play with kind of that education.
First off, I love that song. My dream is to grow up and be Dr. Sue with my own sexual health show and have that as my intro theme. That's what I want when I grow up. Anyway, I think it varies wildly person to person because people's needs with autism vary wildly person to person. So certainly some people can see that there's more nuance and learn placement matters when you're having these conversations, just like there are different rules for different spaces. So, like at a library, you talk quietly. At a sports game, you yell and cheer, and you wouldn't want to yell and cheer in the middle of the library. So, that can help. And also, maybe relating it back to you already know that there are different rules for different spaces, and that these are the rules for this space could help.
I've supported autistic people in going with them to all different types of medical appointments. In preparing for reproductive health appointments, what are some things autistic people should or maybe possibly shouldn't do in preparing for these appointments?
You really don't have to do much to prepare. I would suggest making a list of questions or things that you want to address. I even do this for my own doctor's appointments. In between visits, I have an app on my phone that takes notes, and I jot down things like what medications I need refills of, what problems are concerning me, any questions that I have. And this helps prevent that kind of mind erasure that comes from being in the spotlight, so to say, at the appointment. When you're like, so this has been bothering me for a couple of months, I'm going to bring it up. And the doctor's like, so what brings you in today? Like, I made an appointment. And like, yeah, why? I, Great notes. And that may be more the ADHD talking than the autism, but it helps. Another thing is one thing that you absolutely do not have to do is to trim or remove your pubic hair. If removing or trimming makes you more comfortable, do it, but do it for you. You don't have to do anything special for me. And I've had so many patients with nicks from shaving, ingrown hairs, infected hairs, and even chemical burns from hair removal lotions like Nair. And I'm happy to treat all of these complications, of course, but you never need to feel pressured or feel like you have to apologize for not removing your pubic hair. If you do want to do something to prepare, you can shower before the appointment if it makes you feel more comfortable. Just know why you're coming in is really the only thing you need to do to prepare.
Now, in thinking about these appointments, what do you think are some things medical professionals can do a better job to reduce the harm to autistic people, specifically as it pertains to getting their reproductive health needs met?
Be more flexible and understanding. Do things like don't force eye contact. One, it is hard for everyone, regardless of whether or not you have autism, to discuss the details of your sex life or genital infection while someone's making intense eye contact with you. And so I find that all of my patients seem more comfortable if I'm taking notes and looking down or typing or just not being so confrontational with eye contact when they're telling me things that they feel embarrassed about or feel are taboo to talk about. Also, stop describing autistic people as weird. I've had several instances where a coworker describes a patient as weird, and I have to counter with, no, they're autistic. And just be less judgmental. Don't force anyone to look you in the eye unless truly necessary for the exam. Obviously, there are some exams, like when you go to the eye doctor, they've got to look at your eyes. And I've had to do that a couple of times when I've been concerned for like an overdose or a stroke. Being able to examine the eyes for a few seconds gives us valuable information. Most of the time, staring at the wall is fine for both the patient and the provider. Also, I think you should let people do as much of the talking part of the exam as possible dressed. People feel a lot less vulnerable and more empowered while wearing pants. I also always try to deliver diagnoses, especially life-changing ones, while the person is dressed. The few times I've had to deliver a positive HIV diagnosis, I ensure the person is clothed. One of the first times I had to deliver that diagnosis, someone was getting dressed after a pelvic exam and was just like, "Hey, I had some lab work a couple weeks ago. I never got the results of that. Can you go over it with me?" So I was like, "Yeah, sure." And I was going through her results, like, your cholesterol's a little high and you're a little anemic. And why don't you go ahead and get dressed and then we'll finish going over this? Because I didn't want to tell her while she was half naked that she was HIV positive. Another thing a provider can do is to talk through the exam before starting and offer to continue to talk through every step as it's happening. Some patients want that, while others just want to get in and out as fast as possible, and kind of asking permission or at least warning before touching people. So if I already have your permission to touch you, all right, and now I'm going to touch you here. This is what you can expect to feel. I find it very helpful for more invasive procedures like pap smears or IUD placements that have a lot of different sensations or unexpected sensations or even painful sensations.
Is there anything that I haven't asked you that you would like to share with our listeners?
Yes, there does not need to be any shame in seeking reproductive health care. Also, get tested if you are sexually active, especially if you or your partner have had multiple partners. Many infections may not have noticeable symptoms, and so it's good to just be on top of that. And testing for common infections like chlamydia, gonorrhea, and trichomoniasis is frequently as simple as urinating in a cup. So you don't even have to take your clothes off, you pee in the cup, and you get your test results in a couple of days. HIV can even be tested for with a finger prick, similar to testing someone's blood sugar. And when we do those, you get those results in a few minutes. And syphilis, which is a concern in Ohio, especially in our bigger areas like Cleveland, Columbus, Cincinnati, you can get tested, or I would suggest getting tested once or twice a year, and it's with a blood draw. So if you want, you can even do the blood draw for HIV, syphilis, and hepatitis all at the same time. So 1 needle poke, 3 tests. Another thing I encourage is to ask your provider when to expect your results and how you get them. So many healthcare organizations post your results in a private website or app called MyChart. Know how to get those answers. Also, know what is normal for you in your body. Because even if you're not sexually active, you still might need sexual and reproductive health care. So if something changes, come in. For like those who have vaginas, you should know that it's normal to have a little bit of discharge. It's normal, keeps the genitals moisturized. But if that discharge changes from being white or clear to being like yellow or green, come in. And if you notice itching or an unusual odor, come in. And for the listeners with penises, if your ejaculate starts to hurt or change color or is bloody, you need to see someone. And then for everyone, urination shouldn't be uncomfortable or burning. All of those changes can happen even if you're not sexually active. Like the last one talked about UTIs. They're very common in people with vaginas because the urethra, the hole that you pee from, is like a centimeter away from the vagina, which is 2 to 4 centimeters away from the rectum. So it's all very crammed together and easy for bacteria to move between those holes.
Well, Stephanie, I am so appreciative of this conversation. Thanks so much for joining me here today.
Of course, I was excited.
Thanks so much to Stephanie for the conversation. We always love hearing from you and would especially love to hear from you relating to this episode regarding doctor's visits in terms of sexual and reproductive health care and how they can be more accommodating for autistic people. Did you know Autism Personal Coach provides neurodiversity affirming support by autistics for autistics? We empower autistic adults and teens to be the best version of their authentic selves through customized life coaching and community groups. We also support parents and partners of autistic people by providing insights and guidance to bridge communication gaps and nurture mutual understanding. So please visit autismpersonalcoach.com to begin your experience of judgment free coaching rooted in empathy, expertise, and respect for autistic identity. Until next time, I'm Doug Bletcher of Autism Personal Coach. Talk to you then.